All right. Well, good afternoon, everyone, and welcome to the Greensboro Chamber of Commerce's Vaccine Action Call. I'm Deborah Hooper, the COO for the Chamber, and I just want to welcome everyone. This is a fantastic turnout for today's call, and really, I have to say it's not a surprise because we know there is so much interest in the topics that we're going to cover today. We've been hearing from so many businesses that need and want information about the vaccine and the vaccination process, as well as the legal do's and don'ts that they need to think about with regard to the vaccine. So if you have joined our action calls before, welcome back. We know that there's going to continue to be new information that we need to share. So if we need to set up another call, we will do that. I do want to remind everybody that we are recording the call today to make it available on the Chamber's YouTube channel for everyone, right? If you want to go back and listen to it, if you thought you heard something and you want to listen again, you can do that. And also for those who it just didn't fit their schedule today, they're able to watch it at a convenient time. We're going to hear from our 4 expert panelists first, and then we are going to facilitate any remaining questions that you have. And so we would encourage you to put your questions in the chat room, and we're going to try and get those answered. But again, first, we want our expert panelists to share information with you, and that may actually answer many of the questions that you have. So let me introduce our panelists. First, we have Hattie Gawande. She is Deputy Director of Government Affairs for the North Carolina Department of Health and Human Services. Welcome, Hattie. Dr. Iulia Vann, Director of Guilford County Public Health. Welcome, Dr. Vann. Dr. Deborah Grant, who is Chief Nursing Officer and Vice President of Ambulatory and Clinical Nursing Services for Cone Health. Welcome, Dr. Grant. And Natalie Sanders, who is an employment law attorney with Brooks Pierce. Welcome, Natalie. I also want to introduce my colleague at the Greensboro Chamber, Meredith Berger, who is our Director of Existing Industry and who is going to take it from here. So Meredith, take it away.
All right. First of all, welcome again. I'm so happy to see your faces. Some of you I haven't seen in quite a while, and some names as well who don't have the video on. But thanks again for joining us. This is an important call for us today because, number one, it's an important call to you. And that is what I heard from you on emails, on text, on calls, that this was an important subject that you wanted to know more about for your businesses, for your employees, so that you can make the best decisions possible. So we're excited to have you today. And again, as Deborah said, this is not the end of this conversation. We will continue to send information your way as we get it from these excellent resources in our state and community. So I'd like to go ahead so we can use our time most wisely and send it over to Hattie to kick us off from the North Carolina Department of Health and Human Services.
Great. Thanks, Meredith. Thanks, Deborah. I'm just going to share a deck real quick. So sharing now. If anybody can't see that, let me know. But I'll try to voice over it for those on the phone. I'm going to speed through this deck, and I just want to kind of give a preview. The first half is going to be kind of just some vaccine 101, and some of it you will already know. And so for those of you who already know the information in the first half, I want you to be paying attention to the messages, because one of my ulterior motives here is to recruit you into the core of vaccine messengers who are telling your employees and the community about the vaccine, how it's safe to get the vaccine and how they'll be able to get the vaccine. And especially because the vast majority of us are going to be waiting to get the vaccine, it's good to be socializing some messaging up front. The second half will be more operational details, which I think is the reason why a lot of you are here. So jumping right in. So these are our 5 top line messages that we are really distributing in the community, and that we would love for you to be distributing amongst your employees. I will touch on each of these very quickly. The top line message is that tested, safe, and effective vaccines will help us get back in control of our lives and back to the people and places that we love. In particular, there are some messages around how the vaccines work and how they came to be that I think it's really important to disseminate among your employees. The first is that scientists had a head start, and over 70,000 volunteers helped with the clinical trials. I think there's a lot of perception out there that the vaccines were developed on a quick timeline and sort of jumped through the hoops quickly in a way that we don't typically see vaccines able to do. And a lot of people also know that the vaccines use a new kind of technology. But I think it's important to emphasize that the technology behind the vaccines has been in development and used by researchers for decades. So there's nothing new there. Second is the vaccines are tested, safe, and effective. They had to go through the same level of federal review and approval that other vaccines have to do. And again, over 70,000 participants helped with those clinical trials, and there were no serious health concerns emerging from their experiences. The third, and this is very important, is you cannot get COVID-19 from the vaccine. Like I said, this is a new kind of technology that is used in vaccines. And as a result, there's no live virus in the vaccine. So nobody is going to be getting COVID-19 from the vaccine. Number 4, this is really important and should factor into your planning. And I'll go into the details that factor into this on a later slide, but supplies are very limited right now. And so people should be expecting to have to wait to get vaccinated. But nevertheless, everyone has a spot to get their shot. So again, this is elaborating more on the testing and approval process behind the vaccines. The other thing I will mention on this slide is that often people will have temporary reactions like a sore arm, a headache, or feeling tired and achy for a day or two after getting the vaccine. Quick anecdote, my dad and my 78-year-old grandmother both were part of the Moderna trial, and they both think that they got the vaccine because they both had a low-grade fever for the first 24 hours after getting both shot 1 and shot 2. But as both of them are doctors, as they pointed out, this is a sign that the vaccine is working and a sign that your immune system is gearing up to be able to fight the virus if you are exposed to the COVID-19 virus in the future. I'm going to speed through this, but this is just more information on how you can't get COVID-19 from the vaccine. Instead, the Pfizer and Moderna vaccines give your body's instructions on how to make a protein that teaches your body to make an antibody to fight the real COVID-19. And those antibodies will be able to fight off the real virus if it tries to attack you. One key point is that vaccines will be available to all for free. This is really important that people are aware that they don't have to pay anything for the vaccines, even if they don't have health insurance. This is because the federal government paid for the vaccines. When they're shipped to providers and providers administer them, there might be a small administration fee some providers are charging, but you will not feel that as the patient. They charge insurance for that fee, and if you're uninsured, they're able to get reimbursed through a pool of set aside funds, but nobody should be paying anything for the vaccine. 2 shots are necessary to get full immunity against the virus. If you get the Pfizer vaccine, your second shot will come 3 weeks after the first. If you get the Moderna vaccine, it will come 4 weeks after the first. Everyone needs to get 2 doses of the same vaccine. And a lot of people are concerned about that and think that it might be hard to get their second vaccine, but we built the COVID-19 vaccine management system to help providers make sure people are safe and get the right second dose at the right time. A lot of people have had questions about supply chain when it comes to the second dose. We are shipped the second doses separately from the first doses, and they always come in the exact proportion that we get the first doses. So far we've had no issues receiving the right number of second doses so people can get their second shot. we care a lot about protecting privacy and personal information. And I won't dive too deep into each of these, but we get a lot of questions about whether the vaccine can be tracked when, you can imagine people's concerns about, whether they have microchips and things like that in the vaccine. There is nothing in the vaccine along those lines. It makes a protein that your body can process and dispel the same way it does with other proteins. Nothing's tracked, and your personal information is stored in a HIPAA compliant vaccine management system and will be safe. So I'm going to linger here on the slide just for a second to talk a little bit about what limited supply means. So I think you all have heard probably that it's taking a while to vaccinate those who are currently eligible, which is those 65 and older and healthcare workers. The reason for that is because we're only shipped 120,000 to 140,000 doses each week, which in a state of 10 million is obviously a fraction of the population and a fraction of the vaccinatable population. So just be aware that even when we move on to the next groups that include essential workers, people should be expecting to have to wait to get their shot. They'll be able to schedule an appointment potentially, or they might go on a wait list to get an appointment, but they're not going to be able to get a shot, most people at least, on day 2 of the next group. So limited supply is resulting in wait times, but everybody will eventually get their chance when their priority group is eligible and when vaccine supplies come to their respective jurisdictions. So this is kind of transitioning into more of the operational bits. So first, I just wanted to start by demystifying the way that each jurisdiction gets COVID-19 vaccines. I get a lot of questions about whether we can stop vaccines in transit and, oh, you need to shift this around, and that our hands are really tied there because we at the state level never intercept vaccine. It never passes through our hands. Instead, what happens is every week around Tuesday or Wednesday, the federal government shoots us a note telling us this is how many first doses you're going to get as a state for next week. Just one number. Based on that number, we determine which providers will receive how many doses based on whether they're reaching eligible populations and prioritized populations. And we put in an order with the manufacturer. The manufacturer ships the vaccines directly to those local providers. So like I said, it doesn't pass through our hands at all. And then the providers safely store and handle the vaccines and vaccinate North Carolinians in groups. Because supplies are so limited, we have a prioritization scheme that prioritizes those who are most likely to get COVID-19, at the highest risk of getting COVID-19, and at the highest risk of suffering severe illness from COVID-19. So as many of you know, right now, healthcare workers and those 65 and older, as well as long-term care staff and residents, are eligible to get the vaccine. The next group will be frontline essential workers, and the group after that will be the rest of essential workers, as well as those with underlying conditions, before the general population will be able to get it. And I'll dive into what the worker categories mean in a minute. So who is eligible for group 3? As I mentioned, when North Carolina moves to group 3, which we haven't yet, frontline essential workers will be eligible to get vaccinated. In order to qualify as a frontline essential worker, you have to check 2 boxes. First is you have to work in person at your place of work. So if you're within 6 feet of others as a regular part of your job, you check the first box. The second is you work in one of 8 essential industry sectors. This was determined by a federal advisory committee, CISA. I won't go through each of the ones below, and there is a non-exhaustive list of examples of each of workers in each of these 8 categories, but you must work in one of these 8 essential industry sectors in order to be a frontline essential worker. I get lots of questions about, well, CISA says that this other group is essential, but they're not in one of these 8 essential industry sectors. You would not qualify for group 3 if you're not in one of these 8 categories. So I think that might become more clear when I talk about who's in group 4. So in group 4, additional essential workers become eligible. So first, employees in one of those 8 essential industry sectors who are not frontline can get their shot in group 4. And then employees that work in additional sectors according to that CISA guidance that I mentioned are eligible. There are 11 additional sectors. We have a deep dive on both of these groups available on our website. We're sort of disseminating that amongst employers as well. I'll be sure to provide it to the Greensboro Chamber for dissemination. So those workers, even whether they're frontline or not, are in group 4. And then some of you might also have, there are some niche situations where somebody doesn't do work that qualifies them for, in your respective companies, they don't do work that qualifies them for group 4, but they are an adult with a high risk medical condition. So they might also be eligible in this group. I get a lot of questions about how people will know when and where to get their shot. So we have a limited number of approved vaccine providers in North Carolina. Most of them are local health departments. You'll hear from one of them from your own local health department in a minute, and hospitals, as well as a few federally qualified health centers, rural health centers, and community health centers. Those are all we have call centers to access them. We have a navigator. We have a tool that I'll show you in a minute that lets you kind of enter your area, and you can find vaccine providers near you, and you can call those providers to schedule your appointments, although many of them have wait lists. So much of the time you will end up on a wait list, and they will give you a notification when your time comes out. So these are kind of the main repositories of information that we have built to help people know when and where to get their shot. The catch-all is yourspotyourshot.nc.gov, which includes lists of all this guidance that I've mentioned. It actually includes this deck, but also all the providers and provider numbers and websites that I described. For people who don't have access to internet or are not as comfortable with a computer, they can get that same information at that COVID-19 Vaccine Help Center at the number on the slide. And then there are 2 tools. One is called Find My Group, where you can just sort of enter some basic information about yourself and figure out what group you're in. And one is called Find My Spot, which helps you find a local vaccine provider near you based on your zip code. I think I would really recommend sending those out to your employees. If they are having questions about how to get vaccinated or whether they qualify, those are really helpful tools to help them figure it out. So trying to speed here through the last couple of slides, because I know I've been talking a while, how you can help. Number 1, please start sharing messages with your frontline employees about getting vaccinated, including the messages that I shared in the earlier Vaccine 101 slides. You can share those resources that I mentioned at yourspotyourshot.nc.gov. There are also resources that I'll show on the very last slide, like FAQ and flyers and things like that at that website. These next 2 are what I get the most questions from employers on. First is you can offer to work with local vaccine providers to get your employees vaccinated, but there is an asterisk there. So remember, vaccine is very limited and providers are limited. It's just those local health departments, hospitals, and community health centers, rural health centers, with some limited exceptions. Some of those may be ready to work with you to provide shots to your employees on day 1 of group 3. Many of them will not. And so many of you saw that, especially for the larger counties, it took some time to move over from group 1 to group 2, to move from healthcare workers to 65 plus. We expect that will also be the case when we open the door to frontline essential workers. Every county is in their own place. And so I would say have some patience there. Then consider what type of vaccination model would work best for you and your employees. So for the most part, I think that your employees will mostly be scheduling appointments for themselves. And of course, you can help with that in a number of ways that I'll get into in a minute. I get lots of questions about on-site vaccination. Oh, can I contract with a pharmacy to provide vaccination? I think that will likely be an option down the line, but as long as supply is limited, I think that those opportunities will be limited. So some employers have occupational health programs that can enroll directly with the state to receive vaccine, but enrolling doesn't mean they'll start receiving vaccine on day 1, and it will be a while till we have the supply to provide them with the vaccine. Some of you may have local providers near you who will work with you to set up a vaccination event on your work site or near your work site. But again, that all depends on their supply of vaccine and whether they have the bandwidth to provide that. So again, coordinate with your local vaccine providers, but expect that they are probably not ready at this point to be setting up those kinds of events. And then offer reminders and assistance to your employees to get vaccinated. If you have transportation that you can provide, that's huge. Leave is going to be really important for people who feel side effects. So letting people take 24 to 48 hours if they have a low-grade fever after they get vaccinated will be very important. And then you can potentially provide scheduling assistance. And then these are just our online resources. So I will stop sharing and stop taking up airtime and kick it back to Meredith.
Thank you, Hattie. Thank you so much. And I believe I did send out some information that includes printables and postables for your workplace. We will make sure we send those out again to you, as well as link those in chat as well. Okay, well, let's thank you again, Hattie. We appreciate you today and your willingness to be with us and share that info. Like to move to the local level now, and Dr. Iulia Vann, if will share with us from the Guilford County Department of Public Health.
Yes, thank you so much, Meredith. I appreciate it. Hi, everyone. My name is Dr. Iulia Vann, and I'm the Public Health Director here in Guilford County. And I will talk to you a little bit about the vaccination efforts here at the local level through the health department and some of the plans that we have going forward, as we know that phase 3 is probably going to come in the next few weeks or in the near future. So right now, the health department, as Hattie has mentioned, is in that phase 1 and phase 2 category. We are vaccinating healthcare workers, long-term care facility staff, and residents, as well as individuals 65 and older. To give you a little bit of perspective, Guilford County has approximately 70 to 80,000 people that fit in that category. So we have a large population here in Guilford County that still meet that phase 1, phase 2 criteria. To just give you a little bit of an idea of what do we need to vaccinate before we'll be able to start incorporating some other groups. We are following our North Carolina DHHS framework and phased approach. So we will wait for our state partners to provide guidance on when we will move to that phase 3 essential workers. At this time, we are not there yet. We are also receiving allocations through North Carolina DHHS and our federal partners as a provider. Just like Hattie mentioned, the health department is providing vaccinations to our community members. We do receive a base allocations of vaccines based on the Guilford County population. And possibly in addition to that baseline, we may be receiving additional doses depending on the volume and the bandwidth that the state has for additional doses. For this week, we were fortunate to receive approximately 5,000 additional doses to our base allocation, but we don't know if that is going to continue to happen in the next few weeks. So the more vaccine that we receive, the faster we can give it out and the faster we can vaccinate our community and move through the phases. I think that the word patience is definitely something that we need to continue to share with you as our community leaders, and that for you to do the same thing and share that same message with your team members in your organizations. As far as the vaccine sites that we have at this time, we do have 4 vaccination clinics that are operational. One of them is at our Burr Mill location. We continue to administer second doses for our healthcare workers. We do have the site at Mount Zion, at High Point University Community Center, as well as the Coliseum. We will continue to operate these sites for as long as is needed, and as long as those partnerships will continue to be strong, and we feel like that is going to happen. However, we are looking at a variety of additional sites that we will either partner with other organizations, or we will staff through the county to expand vaccination capacity for our county as we're moving in the stages. We do have right now a few options for those appointments to happen for the vaccines clinics. One of them is our online platform. We do open vaccines appointments for online registration. We also have a call center where people can call in. We also do a reversed call center, especially in our historically marginalized populations. And we also have a very specific, unique, and private link that we're working with our healthcare workers to facilitate that process. I know that you all, so this is what we're doing now. I know that you all want to hear about what are some of our plans moving forward as we're going into that phase 3. And there are still a lot of things that we still need to get more information from our partners. We still need to discuss some internal logistics, but we have started this process about 2 weeks ago because we know that we have to be ready since phase 3 is a very large group, and we need to just be prepared for that. We anticipate that in Guilford County, the process for registration in this phase 3 is going to be a whole lot more employer driven than personal driven. We've learned a lot of lessons, and we found a really good process from our healthcare worker distribution of vaccines, and working directly with the employers in those healthcare settings can be very easily mimicked with the employers in phase 3. So we will probably have the availability of individual registration as well, but it will be a lot easier and a more streamlined process when we're going to be able to work directly with the employer to register, schedule, and do all of the preliminary work for your team members to receive the vaccine. So we've learned a lot from that process. We've improved it, and I think that we'll be able to move forward with that in phase 3. We also believe that there will be tentative clinics, vaccination clinics, that will be designated for the phase 3 groups. So that's why we're working with a lot of our partners to find other places that will be designated to the group 3. We will continue to probably vaccinate in our 3 locations, the community, but we want to make sure that we have some specific locations where you would know to send your employees to. Just like Hattie mentioned, I know that there are a lot of questions around the closed pods, what we call in public health a closed pod. That means that that is a closed point of dispensation in an environment that is only focused on a specific group. So your organization is interested in hosting a vaccine clinic. I know that we're getting some of those questions. At this time, because public health has always been trained, practiced, and have the model of mass vaccinations, that is where we're best at. That's what we're doing the best. And that's what we know that is going to really move us forward a whole lot faster than having multiple sites with smaller throughputs than our mass vaccination clinics. That's where we're equipped to do, that's what we're trained to do, and that's what functions very well in our community in vaccinations through the health department. So that is one area that will be a little bit restricted, at least initially. So we probably won't have the bandwidth to come to your place to administer the vaccine to your team members, but we know the importance of creating spaces that are designated for your groups, and that's what we're working to do. So it is a very heavy lift to move through the phases and vaccinate as many people as possible. We do have limited supply, but we know that we need to be able to be swift, have a very clear process and workflows, because not only that we're focused on the vaccination process, but we're also focused on excellent care and excellent customer service. So we all incorporate that in our processes. We don't want anybody to wait in line for hours. We want to have the resources that they need. the education that they need at that time, and so on and so forth. So all of this is built within the plans that we have for these clinics. Also, a challenge is the transportation, storage, and logistics of the vaccine. So having a clinic that is large enough to move a lot of people through the vaccine also gives us the ability to have those doses necessary on site and not have to transport those doses from smaller points of distribution to the other. So that is also something that we need to keep in mind, that might not be something that is very publicly made when some of the conversations are happening. That vaccine is extremely fragile. It can't be transported but one time or very minimum amount of times. So we need to be very mindful of that. So those are some of the information that we have going forward, and more information is going to come as we find out additional guidance from the state. My last few words for you is that we want you to continue to promote safety measures, mitigation strategies with your team members. We know that public health needs to be everywhere, but our team members can't be everywhere at one time. So we want to use you as public health champions, as our voice in your team members, and follow those recommendations, promote the right information and true information, and try to dispel myths as soon as possible. So with that being said, I would love to be able to provide you with all of the information that you need. Reach out to me if I can give you more information. If you're hearing from your team members information that is really not appropriate, we want to make sure that we're giving all of that information out as soon as possible in the best information that we have out there. Also, if your business or location, I'm sorry, I'm trying not to pay attention to that.
Spam.
Okay.
That's great to know, though. I'm glad to hear that info. So anyway, moving right along.
So if your business or your organization has a facility or has some type of location that maybe you're not using on a regular basis, that could be potentially a location for a vaccination clinic that meets different standards that we have. We work very closely with Mr. Don Campbell, our emergency management director, to really look through those logistics. Please let us know. We're always looking to find additional spaces for us to expand our operations. And lastly, we are working with a marketing company right now to develop educational materials for businesses specifically. We have a timeline of approximately middle of February by that when that campaign is going to be completed. So keep your eyes open and ears open for more information from the health department that will be able to help with educational materials and information for you and your team members. So that wraps up the information that I wanted to share with you, but I will be excited and happy to answer any questions that we have as we move into that question and answer section. Thank you.
Thank you, Dr. Vann. I think your words, employer consideration, and that you are certainly keeping our employers in mind, was all welcome to hear from our companies on the phone. So thank you, and I know we'll continue to share that information from you to them as you get that. So thank you so much again. Next, we'd like to invite Dr. Debbie Grant from Cone Health to present from the Cone Health perspective and another local resource for us. Thank you, Debbie. Let's see. Debbie, I think you might be muted. Let's see. There you go.
Okay. Can you hear me now?
Yes.
Okay, good. Can you see the screen too, Mary?
Yes.
Okay,
Yes.
good.
Thank you.
Yeah, so I wasn't sure if it was coming through. So again, thank you for letting me be here. And I just kind of want to share with our employers and the chamber group what we've been able to do to date. And that's really been working with Dr. Vann and the health department. So we're so great to have that partnership with them. And when we learned from the state, which was back on December the 18th, that we would be able to get vaccine that week. So we started immediately. And you can see here that we've done healthcare providers. We've done over 13,000 healthcare providers now. And that's mainly within all of our hospital systems, but that also was opened up to the community as soon as the state suggested we could do that, which is about 2 weeks ago. So we have been doing the healthcare providers in the community as well. And then on January the 9th, we were allowed to open up to the people over 65 in our community. So again, here you can say that we call them patients, but they may not be patients at all. They're community members. And with those community members, since January the 9th, we've already done over 11,000 community members. And we started that at our Green Valley campus, and then we moved into our Coliseum in partnership with Dr. Vann and the health department there. So to date, we've done already over 24,000. The majority of those are those first doses, and we're just now beginning to do those second doses. But it was interesting to us, and you guys have heard this on the news as business partners, that we've done over 65 counties. And so that has been very interesting that we've had people driving from many different places across our
Hey,
state.
Dr. Grant, we're having some issues. Your presentation got hacked. So I've had to stop your screen share so you can keep going, but it doesn't look like we're going to be able to share your screen.
Well, that's just terrible. We're getting lots of hacking, aren't we? So, it was just going to show there that there was been over 65 counties that have actually come to the Coliseum or at our Green Valley campus to have that. The majority of those have been Guilford County. So again, this is our Chamber of Commerce for Guilford County, but we've also had a large percentage, 9% or so, from Alamance County and from Rockingham County. The next screen was just going to show you about about our vaccination equity, because that's been a really important part for us. And I think to your point, Dr. Vann, while there's large sites that we're trying to do together, like at the Coliseum, we're also very mindful of the racial equity that we want to make sure our vulnerable groups are getting into that. So we've done a lot of our vaccinations now at the Coliseum, and now we're moving into the mobile world. So what we're trying to do now is to partner with our faith leaders, with our business leaders, with our universities, our community leaders. And what we're looking at there is trying to mimic that the vaccinations by race really do compare to our community we live in. So our goals there is to get to the over 40% that are Black and Brown community get vaccinations. So starting tomorrow, since our vaccines are now available, they were not available this week. So as our vaccines are available now, we will actually be doing mobile sites, and we're doing one every single day that we can get those up. And that's 100. And similar to what Dr. Vann was saying, that's done ahead of time. So those faith communities or those businesses will be offered to get that registration ahead of time. So we already have that list, and we'll know who's going to be there, because that's part of why we need to know as far as the number of vaccines to be at that place. So we're doing that as well. And some of our challenges are the same that Dr. Vann spoke of, as well as from the beginning of the state, is just not knowing the allocations that the feds are going to give to the state and then the state will give to us. So that insufficient supply led to much of the news you heard, which was that we had over 10,000 people we had scheduled appointments for, but we were unable to have the vaccine for. So that's what we've been doing over the last 4 days, is calling all those that the initial 5,000 and calling them and getting them rescheduled, and then getting onto the wait list for all the other people who have not been able to get into our system. So we have that wait list now, and as a business partner, again, we want to increase the number of vaccinations we can do both at the Greensboro Coliseum. We've been able to show that and really get to a pace there of doing almost 1,500 per day. So that's something that we've been able to successfully do, and then we'll schedule our second doses there. And then starting tomorrow, we're also opening up in Alamance County. So we'll be at the Burlington Manufacturing Outlet Center there. And then we're looking for a site in Rockingham County, because many of our businesses, as you know, are in all those counties. So we'll continue to work on that. And we'll continue to reach out to our minority groups, and that's our communities there, and trying to make sure they feel comfortable taking the vaccine. So again, a lot of that's around education with those members, and then getting them signed up so we can get them into vaccines. So we're really trying to be right here with each one of our community members. And I think as we go into that phase 3, as you spoke of, Dr. Vann, it'll be getting with our employers to see how we can do that and do more of our mobile type screenings with our employers as well. So we look forward to that future of partnering even more to be able to do that on site. And that was the end of my presentation. That messed up. So
Thank you so much, Dr. Grant. That's okay. You did perfectly fine without the presentation. So that was great information, and we appreciate you being part of the call today. Thank you. Next, we have Natalie Sanders from Brooks Pierce, and I know I had some specific questions around the legal aspects of the vaccine, the legal communication that would best be recommended for workforce, workplace. So we are excited to introduce Natalie today to share her knowledge on that topic. So thank you.
Thank
Natalie.
you. I'm going to go ahead and try to put a couple slides up as well here. So the first big question that we get from employers is, can we mandate the vaccine? And this question comes about because there are certain laws that limit medical examinations that employers can require of their employees. And so the answer here is yes, because the EEOC that administers those applicable laws has come out with guidance and said that the vaccine itself is not a medical examination. So it can actually be required. Now, the rules under the Americans with Disabilities Act, which is the applicable law here, still apply with respect to the gathering of any medical information. So those pre-screening questions, if the employer were to be the one providing the actual vaccine, you'd have those issues. Also, questions about asking why someone's not getting vaccinated could lead to medical inquiries. So you have to caution employers on those things. And so the yes here is also a yes, but, and this is what I think trips up employers a lot is, okay, we can mandate it. You can mandate it, but it doesn't necessarily mean that you will actually be able to exclude all the employees from your workplace who don't get vaccinated. And so why is that? Well, we have these laws that come into play that say employers must make certain accommodations. If there's an underlying health condition or a sincerely held religious belief that keeps someone from getting the vaccine, you need to make some accommodations. And what does that mean? What accommodations, and why is this an issue? Well, if an employee can't get a vaccine, you're required to engage in reasonable accommodation process. And the vaccine can be required because you're saying it's posing a direct threat in the workplace, either to that individual that they might contract COVID or to others in the workplace or our customers, those sorts of things. So you have to determine, well, can you accommodate that risk? Well, what have we been doing? We've all been wearing our masks, social distancing, and telling people they're safe in the workplace, or we're having people work from home. So all of these things are happening. They seem like they might be reasonable accommodations that can either eliminate that risk or significantly reduce it. So if you have people who are asking for these types of accommodations, you may not be able to exclude them from the workplace simply because they didn't get vaccinated. Then whether you're getting a mandatory vaccination policy or some sort of incentive program. If you get vaccinated, we're going to provide you this incentive. That's the next question we get. Can we require proof that people have been vaccinated? And the answer, again, the EEOC has come out and said that that proof of the vaccination is not an actual medical inquiry. You're not getting medical information from the employee simply by asking for that proof. We caution you, however, that a lot of times additional information may come along with that. So make it clear to the employees you do not want the additional information. And if it comes your way, you need to send it back and have them try again. But if you don't get additional information, medical information, then you're okay to ask for that proof. Here are quickly the other considerations I want to throw out there for you. Obviously, the mandatory, voluntary with incentives. If nothing else, you've heard it over and over, educate your employees, give them access to information. You've got to think about your personal workforce. How will they react? I've had clients tell me that I'd love to mandate it, and we've talked through it, and I think they have a good way to do it. They can justify it, but they have a large group of employees they think don't want the vaccine, and they're afraid they wouldn't be able to function. So you have to think through it practically. Of course, if you have a union involved, you have to look at your collective bargaining agreement, what additional issues may be if you have to bargain with the union about this. Think about wage issues under the Fair Labor Standards Act. Does someone have to be paid for their time getting the vaccine? Do you need to provide them time off? All those issues come into play, and issues that are different whether you have an exempt employee or a non-exempt employee. And then think about your OSHA requirements. We have a new administration. We have new expectations of what's going to happen with regard to OSHA and how they're going to be involved in your workplace safety with respect to COVID. And given all of that and the duty clause that says you need to provide a safe work environment, will you be able to provide a safe work environment without mandating vaccinations? So there's a lot to think about there. We're here to help you, attorneys at Brooks Pierce, because these are complicated issues, and I've thrown a lot out fast, but I wanted to make sure that there's time for you all to ask the questions that are most important to you and have access to all of us here today.
Thank you so much, Natalie. That's good information, a lot to think about. I do have a couple of questions that came through on personal chat to me on my cell phone, since the other doesn't seem to be cooperating with us. Number one, on the incentives, could you do a little bit of a deeper dive into incentives that employees could potentially get for being vaccinated, or what your commentary is on that?
So the problems that you run into with incentives, especially at this early stage, is there's only a certain group of people that are able to, even eligible to get the vaccines right now. As we move along, vaccines become more and more available, those kinds of incentive programs will be easier. So we've seen employers want to do things like, and I think this is one of the safer options, is putting together some sort of, your name's going to go in for a drawing, and they have some great prizes. You want to be careful that it's not looking like compensation, and you need to make accommodations even for those people who can't get vaccinated, that they can participate in the incentive as well. So you've got those accommodation issues even there. The trick would be doing something where you know everyone's going to have the same opportunity, regardless of the timing of when they get that vaccine. So if you're going to put names in for a drawing, you may say, once we get 50 names in, we're going to draw, and then you start over another 50 until you keep going along, so that no one's left out or getting a different benefit or chance for the drawing.
Thank you. I think this question is probably for Dr. Vann. Dr. Vann, when a location in the county or otherwise is set up, it might be an option for employers to send their employees. Will that be something that's posted on the Guilford County website, or how would that be communicated so that companies can know that?
Yes, so we'll have various ways in which we're going to communicate with you on that. We'll post it on our website, but I think that we're definitely going to use the chamber as a communication method to make sure that that information is reaching you, and you have all of the details necessary for that. We also have a system that is called Everbridge, through which we're able to send mass notifications. So we'll be able to use that system as well.
Thank you.
Meredith, this is Debbie. We can use that same type of system through our My Chart, and for all the people in our community who are on that system, to alert them as well when we together are doing that next phase.
Thank you. I know we have some employers with employees in neighboring counties as well. So just a way that not only Guilford County, but other counties can get that information would be great. So I have a couple other questions here. If the employer provides incentives to take vaccination, does that create legal liability if the person has an adverse reaction to the vaccine?
That's a question everyone's asking. You know, what are your potential liabilities out there? We're living in the unknown. We don't have those answers. If it's mandatory, it seems like you would have some greater responsibilities. Perhaps you would even have workers' comp claims for those. We don't know yet. If it's more of a voluntary, you're providing some sort of incentive. if you're not the one actually giving the vaccine, someone else is giving the vaccine, they should be asking the appropriate screening questions. Is it going to be the employer's fault? It's not. Is someone going to claim that it is? Possibly. So it is an unknown. I think everyone's doing their best and thinking, how are we going to keep the bulk of our employees safe and healthy and doing the best they can? But unfortunately, I don't have a crystal ball to tell you the exact answers on that.
Understood. Thank you. I have a couple different questions here. I'm going to hopefully summarize them. It looks like, can we get some guidance maybe from Hattie on this, whether the state will make a single statewide decision regarding the time frame on moving into phase 3, or if it's a certain county might be allowed to move into phase 3 first based on that county's progress, or just really that timeline or estimated time frame for that phase?
Great question. No counties can move into group 3 on their own, as long as there are long lines of those 65 plus who still need to get vaccinated. We don't want counties who are getting through that population quicker to move on when we could transfer their doses to counties that have more need. Again, I think I may have mentioned those 65 plus, the data shows that they are inarguably the most vulnerable. 83% of our deaths in North Carolina are those 65 plus. So we really don't want people jumping the gun when we could be maximizing the resources for those communities. So employers will hear from us, trust me, loud and clear when it's time to be moving to group 3, and before that, nobody should be moving.
Do those folks need any specific verification of employment or qualifications needed for those employees who will be in group 3?
So our provider guidance currently says that people neither need identification nor a note from their employer to get vaccinated. They can self-attest to their eligibility.
Okay. Let's see here. Jumping around a little bit here, going back to eligibility categories, is there a specific spot for construction workers or construction employees who are also providing COVID-related cleaning and disinfecting as part of the business?
Yeah, I've gotten lots of specific questions about people who are in jobs that are related to COVID or adjacent to COVID. And the answer is everybody on the front lines has, in an essential industry, is getting exposed to COVID on the regular. And so all of them are encompassed in group 3. Nobody at the state level is prioritized in front of other groups.
Okay. And Hattie, how will employers know? Or is there a list they can get on? Is there an email they need to provide or a sign up they need to do in order to be notified by the Department of Health and Human Services to ensure that they receive notification?
Yeah, so it depends on what you want to receive notification for. So if you want to know that we'll be moving to group 3, you will hear it from all the business associations under the sun. You'll hear it in the Secretary and Governor's press conferences. We'll be socializing it via the media. We'll put it out via our stakeholder groups and through the press. So that will be, I think you'll be well aware when that time comes. And of course, our vaccine providers will hear in advance. I would say if you want additional information in terms of guidance or that will affect your business, a couple of things. One is all of our guidance lives on our website, covid19.ncdhhs.gov, also at yourspotyourshot.nc.gov for the more public-facing resources. There is specific employer guidance that's coming out later today that I will share with the chamber to share with you all. It will, of course, live on our website. It will have a lot of the same information that's in those deeper dives that Holly linked to in the chat, but it will include some just general gating information about what to expect as well. So website, and trust me, you'll hear it loud and clear when we move.
And from me as well, because I will be blasting this out as soon as I get it from you all as well. I think this is a question for Natalie. Natalie, this is an example of a question that a company had about an incentive. We are going to do an additional day of PTO if someone gets the vaccination. If they leave work and are paid on an hourly basis, we are excusing it, not paying them during that time. Is that legally okay?
Okay, that's a very specific question.
Maybe I'll send it to you afterwards.
I would have to have probably some more facts and circumstances in order to be able to answer.
Okay.
So I will just talk generally that it is another common thing that we are seeing for employers to offer those getting vaccines an extra day of paid time off as an incentive, that the day after you get your second dose, especially as an extra day off. There are definitely employers doing that, but have to get into the specifics of each situation, mentioning exempt, non-exempt, all of these things are things we would have to go through on a case-by-case basis.
Okay. I may send you that one on the side just so that you
Sure.
have it. Can a company require that all visitors, including service providers, show proof of vaccine before entering?
Throwing that one to me as well?
Yeah.
Okay.
Oh, yeah. Do you need to send that one later too? Okay.
Yeah, I'm not sure we know what the answer to that one is going to be.
Okay.
We're seeing it in the travel areas where, negative test results are being required. So where are we headed and what will be required? It's possible, especially if you have a workforce that you have mandated vaccinations. Does it make sense? And do you have the ability to say this is mandatory because it's so important to what we do here that everyone be vaccinated, and then have customers and vendors and everybody else coming in and not caring whether they're vaccinated or not? So yeah, it's a question we don't know the answer to yet, but it's great to have people thinking about it, especially as they're considering whether or not they're going to make it a mandatory vaccination for their employees.
Thank you. We'll do a couple more here. Hattie, should a business register for the NCDHHS CVMS?
So what this question is referring to is the COVID-19 vaccine management system, which I mentioned briefly in the presentation. And that is the centralized portal where all vaccine providers have to enroll in order to eventually be onboarded and eligible to receive vaccine. We are adding additional functionality to CVMS we're adding an organization portal that will allow employers, and organizations to upload lists of their employees to make the registration a little bit easier for our vaccine providers. You don't have to do that, and it's still being tested now. It's still in being developed, so nothing for you to do now, but that will be an option for you down the line. I think those of you who have occupational health programs on site can enroll in CVMS to become a vaccine provider. But a couple of important caveats to that. First, enrolling does not mean that you are onboarded and able to receive vaccine. We have very little vaccine right now in the state. All of our vaccine providers are doing an awesome job. If we enroll big occupational health programs, it means we would have to take vaccine away from our existing providers, and they're doing great. So we don't really want to do that right now until we see a big increase in our supply. So I think it's good to be proactive and enroll if your team has the bandwidth to start that enrollment process, but just expect that that will not get you a vaccine anytime in the coming weeks.
Thank you so much, Hattie. And I know we're approaching our time here, and Deborah's going to wrap us up, but I just wanted to personally thank our industries and companies for taking the time today. And don't think you will not hear from us shortly, because you will. As soon as we get anything, we will share it with you. Please feel free to follow up with me with questions as well, and we'll make sure we get those answered for you. And Deborah, I'll let you do the official wrap.
Well, Meredith, let me thank you personally as well for helping to organize today's call and facilitating such a valuable call. I want to thank all of our panelists, Hattie Gawande with the state, Dr. Iulia Vann with Guilford County Public Health, Dr. Debbie Grant with Cone Health, and Natalie Sanders with Brooks Pierce. You all have provided such valuable information today, and we greatly appreciate you taking the time to share this information with everyone. Just as a reminder, we are going to send a post-call communication that will have the link to this recording, as well as, again, resource links, the slide decks, and please note, this is likely not to be the one and only call on the vaccine and the vaccination process. And I just want to remind everybody and just reiterate what's already been said. Let's all continue to do what we can to encourage everyone to be safe and to stay well. So the 3 W's. And thank you all for being with us.
Thank you. See you all soon.
Good evening.
Thank you very much.